Okay, so today I'm going to talk about Medicare Advantage plans. And some people either trash Medicare Advantage plans or they say that they're great. And what I'm going to do in this video is I'm going to give 3 positives about Medicare Advantage plans and then give 3 negatives about Medicare Advantage plans. And at the end, tell you what my thoughts are from all the years of putting people on Advantage plans and putting people on Medicare supplement plans and the feedback that I've gotten from all of these people. All right, so the biggest thing that people love about Medicare Advantage plans are that the majority of them are zero premium plans. So they cost nothing out of pocket per month. And they might go up to about $50 a month in premiums each month, but that's about it for most of them. And so what this means is if you get a plan, you pay nothing each month unless you use it. And sometimes there could be a copay of $5 to go to the doctor or $10, but the premiums are what people love. They're zero. So you pay nothing. And some people say, well, how can that be? Well, the government gives subsidies to the Medicare Advantage plan companies, and this keeps their costs down. So they charge zero out of pocket each month. The second thing that people love with the Medicare Advantage plans are the fact that the package is all combined, meaning you get extra benefits with Medicare Advantage plans that you wouldn't get with a Medicare supplement. So for instance, you have your doctor and hospital coverage, but then the Advantage plans also combine the Part D drug plan and vision, dental, and hearing. And some of them even pay the Part B premium that you have to pay to the government each month or each quarter for your Medicare Part B. So there's a lot of benefits that the Medicare Advantage plans are giving to people, and that's the second reason why people like them so much. So the third thing that people love about Medicare Advantage plans is if you are healthy and you only go to the doctor sporadically and possibly you have a procedure once or twice a year, the savings that you get from the Medicare Advantage plans is significant. So for instance, with the Medicare supplement plans, you might be paying over $100 a month in premiums for your medical and doctors. And you might be paying $30 a month for your prescription drug plan. And then you might have to get a separate vision, dental, and hearing that might cost $40 a month. With the Medicare Advantage plans, like I said, the premium is zero and you pay as you go. And a lot of people are not using these plans as much as they thought they would. So they do love the Medicare Advantage plans. Now, I'm going to get into the negative parts of the Medicare Advantage plans. And like I said, some people love them, some people hate them. And then I'm going to go over what my clients have said in the past and in the present about Medicare Advantage plans. Okay, so the biggest negative to the Medicare Advantage plans that I have heard is that they have networks, some of them, but also that not all doctors will take these plans. So for instance, if you're on a Medicare supplement plan, you can go anywhere in the country that accepts Medicare. You do not have to call the doctor and say, hey, I have an Aetna plan, or I have a Blue Cross plan, or I have a Cigna plan, G, or I have a Medicare supplement plan. Do you take it? As long as they take Medicare, by law, they have to accept the Medicare supplement plan. And if you have a plan G or something like that, they're going to cover the whole entire cost. So let's just say you travel a lot or you go to different doctors, you want to go to specific doctors. The Medicare supplement plans are much better. So with the Medicare Advantage plans, people do complain. I've had people that have said it was hard for me to find a dentist. I had to switch mine. Or they said a certain procedure wasn't covered anymore from the Medicare Advantage plan. I just had someone that switched out of a Medicare Advantage plan because they said that a procedure he had to go into was $650 and he called the company. They no longer cover it right in the middle of the year. Luckily, he was on a trial right and he was able to switch back. And I go into that in another video. But I've had complaints about it from multiple people. And most of the time, it's because they cannot go to the specific doctors that they want. The second biggest drawback from what I've heard about the Medicare Advantage plans are the fact that you have to get like pre-certifications and you have to find out if something is covered or where you can get something. Like, let's say you want to get a wheelchair or something like that. You have to make sure that you get it from a specific place. And also, if you need a procedure and you think that you can go in and just get it done. A lot of times you have to call ahead and say, hey, is this covered? Do I need the company to okay it? Whereas the Medicare supplement plan, everything is covered. If you have to go to the hospital, if you're on a Medicare supplement plan G, and you go to the hospital and you have open heart surgery, or you had a stroke, you go in, or you need a knee replacement or something like that, or anything, they will do it, and they will not ask questions and so forth. The doctor will do the procedure, they'll send it in, and the doctor will get paid. Medicare will pay for it. Medicare Advantage plans are kind of like when you're under 65. It's like wheeling and dealing with the company. You're not sure. It's a private company, so you're not sure that what they're going to pay for and if they're going to pay for it at all. So people have complained about this to me multiple times, especially if they're using the plan a lot. So this is one of the drawbacks to Medicare Advantage plans. So that's number 2. And the number 3 reason is kind of a two-part reason. The first thing about the number 3 reason is that if you are on a Medicare Advantage plan and you are unhealthy, or you want to get on a Medicare supplement plan, you will be asked health questions to get on that Medicare supplement plan. So if you're in a Medicare supplement plan and you're happy, but you're paying a little bit and you think to yourself, well, I might be paying too much, you only get one time on a Medicare Advantage plan where you can try it. It's called a trial right for 12 months, and then you have to go to a Medicare supplement plan, or they're going to ask health questions. So it is a big drawback. Medicare Advantage plans don't ask any health questions. Everybody's accepted. And so that makes people leery, they not being able to go back on a Medicare supplement plan if they really like it. The second thing is the max out of pocket for these Medicare Advantage plans can be very high, and it goes up every year. So for instance, the max out of pocket could be over $7,000 per year. And if you're someone that's going to the doctors a lot, or especially getting procedures done, I had a woman who had to get MRIs 3 or 4 times a year for a specific reason. Those MRIs can cost $300 a pop. And then also there's other things that she was doing, going to specialists and so forth, that cost a lot of money. She was actually closing in on that $7,000, where if she was on a Medicare supplement plan, it would have been covered and it would have been much cheaper. Thanks for watching this video on Medicare Advantage plans. If you need more information on Medicare and different subjects, you can go to my YouTube channel page by going underneath the description box right above the comments and click on the picture or where it says Brian Medicare, and you'll go to my YouTube channel page and you can watch playlists there. Most of my videos are under 3 minutes. I try to make them simple. If you need to contact me, in the description box, there's also my phone number and my website address, along with other things that might be helpful to you. Thanks for watching the video, and I'll see you at the next one.